Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast.
Okay, so welcome everybody. This is our functional medicine discussion group meeting with Dr. Aristo Vojdani on precision environmental health. And we're very happy to have Dr. Vojdani. He's one of the most awesome speakers. He is the president. He's the chief science officer of Cyrex Labs. And so
owner of Immunosciences Lab.
And the owner of Immunosciences Lab. So we're going to make a couple of introductory announcements. So we have 3 sponsors for this evening. So we have Cyrex Labs. Buffy, did you want to come up and say something about Cyrex Labs? Okay, so use this microphone. It doesn't amplify to the room, but it goes directly to my camera.
My voice carries anyway if I really need it. Good evening. Good evening, everybody. I'm super excited to be here. And if I haven't had the opportunity to reach out to you yet and let you know, because I know a lot of you are already existing Cyrex account holders, I did lose my Southern California rep, Heather Sunshine. I still talk to her every day. She says hello to all of you, but I am taking over in her stead. Lots of exciting things happening at Cyrex, so come by and talk to me. A lot of different promotions in my pocket for you. If you are unfamiliar with the lab, we are a functional immunology laboratory devoted to kind of environmentally induced. I like to think of it as how not to get autoimmunity, early detection, identification, prevention. We have testing for essential barriers, leaky gut, leaky brain. We have a whole host of trigger testing, food sensitivities, chemical toxicity, latent pathogens. We have a cognitive health assessment. Dr. Vojdani's most recent panel looks at subpopulations of lymphocytes, actually giving you an immune fingerprint of your patient. We're doing immunophenotyping using monoclonal antibody staining with flow cytometry. We have a new panel coming out Q2, although I can't tell you yet, but it is super exciting. And I'm thrilled to be here with Rubina, Dr. Vojdani's daughter, who's with Immunosciences. He's got some great stuff coming out as well, but I don't want to steal her thunder. So by all means, come talk to me. Thank you for having us, Dr. Weitz. We're delighted to be sponsoring this event. Thank you.
Now, we're very grateful that Integrative Therapeutics has been sponsoring all our meetings, and Steve Schneider is going to come up and tell us about a few of their products.
Everybody knows me because I'm here every time almost, but we're excited to be here, and I want to listen to what you have to say. We have back there some of our biggest selling products, the HPA Access stuff, including Cortisol Manager. The Cortisol Manager actually was, in 2024, was the #1 selling product on FullScript for the 6th year in a row. Actually, the highest dollar volume product that they sell, we also have Active B Complex, which they sell more bottles of than anything else, and that's been 4 years in a row. So come back and take some samples and enjoy the talk. That's all I got.
Thank you so much, Steve. One of the few brands of professional supplements we carry in our office. And then our third sponsor for this evening is Quicksilver Scientific. There's some brochures on the front desk there as you come in. And Quicksilver Scientific is another one of the premier professional supplement companies, and they specialize in detoxification. And we use their push-catch detox protocols for removing heavy metals and mycotoxins and a whole lot of other environmental toxins, which consists of liposomal glutathione and their specialized binder, ultra binder, and liver support. great products. I just mentioned one thing anecdotally. I have a patient, he's had chronic kidney disease for years, and I have lots of protocols to rebuild his gut, etc. And I put him on their kidney support, and he just came back, and his GFR, his glomerular filtration rate, which is a measure of kidney function, went up 9 points, which is like unheard of. So, anyway, so we're very happy that Dr. Vojdani will now be telling us about environmental medicine.
Thank you, Dr. Weitz. Thank you for coming. So why I chose this title? Because this title is the closest to my heart. Secondly, because this was published very recently in Nature Communications, which is the highest level of excellence in scientific journals.
These people are all on.
So exactly the title of that
that's great then.
is Precision Environmental Health in Preventing Disease. So precision environmental health is major part of precision medicine. Precision medicine or personalized medicine. You guys are already familiar with, right? It's nothing new for you. So how come these journals are making such a big deal out of it?
How do I know what they're
So that's why I wanted to present this to you. And most of you at the end will say, well, we have done this in the past 40, 50 years. Why right now mainstream medicine, right? They take over. But that's how the science is. If you don't have good marketing, if you don't have,
probably winning promotions.
all the tools to take over a subject, then others will take over. This past weekend, I was at the American Academy of Environmental Medicine in San Antonio. And one of the major speakers was Aaron Burakovitz, which really enjoyed listening to her. So, environmental medicine, as you know, 65 years ago, they started 65 years ago, and they developed the oral desensitization, not these 3-4 allergists who are making billions of dollars right now. American Academy of Environmental Medicine members developed that method almost 65 years ago. So anyway, that's how the science is, but let's learn a little bit more about this. So again, what is precision medicine? Please read the definition. Nothing new for you and I. Okay, so according to the Precision Medicine Initiative, precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in the genes, gene plus environment, and the lifestyle for each person. So lifestyle and PLMI, personalized and lifestyle medicine. Isn't that? So Dr. Bland started that almost 20 years ago. Functional medicine. I participated in the first functional medicine meeting in 1992. So this is not new to us. Okay? So let's move on. So precision environmental health is part of precision medicine and is determined by the interaction of our environment with the genome, epigenome, and microbiome, which shape the transcriptomic, proteomic, metabolomic landscape of cells and tissues. So this is my article, from my own article. 3 or 4 years ago, I wrote 2 different articles about the role of exposome, whatever we are exposed to, in the outdoor environment and inside body environment as well. Outdoor, indoor, as well as our own body. Altogether, genes plus infections, toxic chemicals, dietary components, and their effect on gut microbiome and microbiome. Please do not forget the microbiome. Together can contribute many diseases. Autoimmune disease is just one example. So that was published in a journal called Pathophysiology. So now, precision environmental is an emerging field leveraging environmental and system-level data to understand underlying environmental causes of disease. So, again, we already emphasized that it was all in those 4 circles.
Harold, I don't think I'm going to stay on this.
The concept
You've got such an accent, I can't understand that.
precision environment is based on an appreciation of the impact
Should I get dinner ready or go up in
from
the back?
exposure have on.
Do you want dinner or should I
Health,
go past
again.
first?
We already had that definition of precision medicine. This is repeating itself. But please, again, look at the article.
I can't hear you.
Nature Communication. Look at this one. Imagine a future when you could take a simple blood test to determine if you have been exposed to chemicals in the environment that can harm you, that can harm your health. Your healthcare provider will then offer solutions to ameliorate that exposure and or prevent its adverse health effects. Is this new?
No.
Okay, thank you. So, look at this. Immune alteration associated with exposure to toxic chemicals, published in 1992, meaning we did the research in 1990 or 1991. So we took a group of several hundred at that time of individuals who were exposed to solvents. And we did measure autoantibody in their blood, and also we looked at cell-mediated immunity, lymphocyte subpopulation, half of that we do today at Cyrex. Because then we didn't have Th1, Th2, Treg, Th17, and 5 different types of natural killer cells. But even that, with that limitation, we showed that those who were exposed to toxic chemicals had high levels of anti-nuclear antibody, rheumatoid factor, immune complexes, smooth muscle antibody. Their lymphocyte subpopulation was completely, either it was overactive or underactive, meaning CD4, CD8 ratios were very high, which correlates with autoimmunity. And when it's very low, it's immunodeficiency. So that was done in 1990, 1991, and this is the publication. So that blood test was, in the laboratory, at least in our clinical immunology laboratory, since 1989. That's the time when immunosciences lab was established in Los Angeles. So, antibodies to environmental factors help in the identification of triggers. So really, this is my message to take home with you. Detect, remove, and repair. So detect by looking at as an immunologist I'm talking, humoral immunity, whatever you can find in the serum, including antibodies, and cell-mediated immunity, the T cells, B cell, Th1, Th2, and all of that, which is offered by Cyrex. And if any of these are positive, you have to have some kind of plants. You see in the picture, that's mercury, infection. So you have to, and then food, dietary proteins and peptides. You have to remove them from the environment of the patients. And then most of the time, the barriers are damaged by all these environmental factors. You have to repair them. And hopefully by doing these three things, you can reverse, either you stop completely or even reverse the course of inflammatory, autoimmune, neurodegenerative, and many other disorders. So now, the same article talking about the microbiome is a key interface between exogenous and endogenous exposure. And again, really, I dealt with that under the name of exposome. And the microbiome is part of our inside of our body that it is playing so much role in different disorders. So this is how also I summarized it based on the exposome and immune connections overview of the Cyrex system. So first we look at the gut microbiome disturbance. Gut microbiome disturbance are responsible for releasing toxins. For example, what you don't see here, I'm giving you a little bit hint for our future development. Candida albicans releases a toxin called, it's real mycotoxin, Candida lysine. And that can break down the tight junction. And then unwanted macromolecules, undigested food, E. coli antigens, salmonella antigens, other antigens. When the biological door is open, enter into the circulation, immune system reacts against that. We make antibodies and we detect that in the laboratory. So here, that's why antibodies are detected in array 2, 3. These are all looking at the barriers, the food, the toxic chemicals, and the pathogens. And then you look at lymphocyte map. You look at, that was the antibody. Lymphocyte map, you look at CD4, CD8, Th1, Th2, Th17, and each one of them have different characteristics which can correlate with different disorders. For example, as you know, T helper 17 in the gut is taking care of pathogens such as Candida albicans. But when too much Th17, for some reason, too much activity of Th17, then they can turn against our tissue, and T helper 17 could become pathogenic. The same thing for Th1. That's why overactivation of Th1 and Th17 could result in autoimmune disease. That's why we call them auto-reactive lymphocytes, meaning they react against our own tissue. And so, therefore, multiple autoimmune reactivities against tight junction, skin, nervous system, thyroid, joint, and many other parts of the body. So the exposome represents a framework to study environmental drivers of health and disease. And the ultimate goal of exposomic science is to actually define the totality of an individual's chemical and non-chemical exposure. So we have to also to be able to find that patient which is coming to you, is it exposed to toxic chemicals, which one of them? We can do that either by measuring the chemicals, I'll say where is the most important in the tissue, but unfortunately, we cannot cut a piece of tissue and measure chemicals. The only choice we have to measure antibodies against the chemicals. We call those neo-antigens because chemicals bind to human tissue, forming a new complex. And so therefore, we measure antibody against that.
By the way, Dr. B, a lot of people are confused about the difference between an antigen and an antibody. Can you explain what that is?
Thank you so much. Okay. An antigen, any protein, glycoprotein, lipoprotein, but mainly protein, whether it is from food, from pathogens, unwantedly get into the human system. That is called an antigen. When the immune system reacts against that antigen and makes whatever, the protein, another protein in the body made against the antigen is called antibody. That's why antibody. Imagine the body is the antigen, in this case, the antigen. And our body makes antibody against the antigen. So antigen is something, foreign material, gets to our system from the environment. When the immune system reacts against that, makes antibodies. There are five major clinically important, 5 or 4 different antibodies, and the best to remember, GAME, IgG, IgA, IgM, and IgE. That's what we measure. IgE is related to allergies, IgG and IgA and IgM related to non-allergic reaction. That, for example, you get exposed to Lyme, and you make IgG and IgM against Lyme pathogen or Enobacter. So that's the definition of antigen and antibody. Thank you for asking. The same thing that I presented, you'll see toxic chemicals. We do the same. Okay, so that's why the end result, honestly, is almost the same. Whether pathogens or toxic chemicals or food, antigens get into our body. Now, regarding the chemicals, we cannot call the chemicals antigens. Why? Because chemicals are very small molecules. By themselves, cannot generate antibody production. In order to make antibodies against chemicals, the chemicals, after entering into the body, should bind strongly to human tissue, and then now we react against the combination of chemicals plus human tissue. We call that neo-antigen. One of the best and simplest example of neo-antigen is aluminum, which is in the cheese, in the water, almost everywhere. Because our water filtration system, they are using lots of aluminum. So the water that we are drinking, we don't have filter at home, we are drinking a lot of aluminum. And the other reason one of the reasons that they added aluminum to water and then to cheese that we eat and many other products, they think aluminum is in and out. They think also every other chemicals, they get in, they get out. Unfortunately, that's not the case. An article was published almost 8 years ago in the journal called Mucosal Immunology. They show that 70% of the aluminum get into digestive tract, binds to epithelial cells. Isn't that going to break the tight junctions? And then some of it may get into the blood, and the structure of aluminum is in such a way is Al back to school. Al 3 plus. Okay, positive ion get attracted to negative ions. And then you are going to have aluminum now is binding to zonulin in the gut. It's going to bind to enzymes in the gut. It's going to bind to muscle antigen. So therefore, they become neo-antigen, and we make antibodies in chemical plus the antigen. I did publish an article 3 years ago that most of us, we have high levels of antibody against aluminum in our blood because we are exposed on a daily basis. Please.
Yeah, I was going to ask about the common mechanism we understand about how we get autoimmunity is there's this cross-reactivity where the antibodies that react against the substance and react to our own tissues. And I was going to ask if there's chemicals that are not really antigens, and is the mechanism different? But you just explained.
I just explained the mechanism. Thank you for asking. So yes, chemicals by themselves are not an antigen. They are named haptens. H-A-P-T-E-N. Hapten by itself is not an antigen, but when it binds to human tissue, becomes a complex with an antigen. And definitely now becomes a super antigen. We react, we make antibody against the chemical, aluminum, as well as the tissue that it's bound to. Okay. So the hallmarks of precision environmental health is, they say, laboratory testing, and this is taken almost from that article, long-term exposure to toxicants. We take peripheral blood, we measure humoral cell-mediated immunity, neo-antigen formation and antibody against that. You look at cellular immunity, and now you have a new blood-based biomarkers of toxicant exposure. So you have to look at both antibodies and cellular immunity together. That's the best combination of looking at exposure to environmental factors. Now, what do you think about this picture? If I have the strongest message for you today, okay? Please get rid of this. If you can, at home, at your work, for your patients, it's not just this. This plus another 100,000 toxic chemicals. That's really the message in here. They try to say, okay, bisphenol A now, it's not bisphenol A, another piece of plastic. I think we are going to the wrong direction, unfortunately. And like now in Whole Foods, you see we have these Neo-plastics. They are biodegradable. Biodegradable still is toxic chemical. I don't care about biodegradable or not. I want to phase out all these chemicals. That's really my real message tonight. If we can do that together.
You talk about like the biodegradable bags. Aren't they made out of natural materials? No,
I don't think so.
Bags are, but not the boxes. Those are made. They're not from plastic.
They're not?
They're mixed material.
They are synthetic material.
Oh, okay.
But some organism, whatever they can, break them down and get rid of them.
Oh, okay.
Okay. So let's continue. So what do you think about these nano-microplastics and invisible threat getting into the brain health? So very fast I'll go through these, just like to see how many publications now we have in scientific journals. The nano and microplastics Now they're detected by probably billions particles in our prostate, our thyroid, our breast, and almost in the heart. And they found even not only that correlation between the amount of nanoplastic and microplastic with cardiovascular disease, with breast cancer, with thyroid autoimmunity and thyroid cancer. So please, if this is not enough, what else you are looking for? We have to do something about eliminating these chemicals from the environment. But still, they are these nano microplastics, because of usage of these for probably 80 years. First, we thought they were in the fish and shrimp. Now it is in our tissue. I don't like this. All right. Oh, wow. What happened?
It's a stop.
The plastic?
It's good. It's good.
Okay, thank you. So, just I'm showing you the slides. Okay, please, I'm not going to into the brain. So don't you think there is some relationship between more Alzheimer's than some of these in our brain? Of course there is. Here, the picture. This is our body with nano and microplastic. There is no part of the body that there is no these nanoparticles in it. And so that's because of all of this. So probably they looked at fish before, but now it's a human brain. Blood-brain barrier and nasal root integrating with the CNS system. So that's why when we do, I think it's array 20 for blood-brain barriers, we find so many people have problems, not only with the gut barriers, also they have problems with their blood-brain barriers.
Is there a nasal brain barrier? Is there a nasal brain barrier?
I'm sure there is. Yes.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration, and it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code WEITZ, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code WEITZ today. And now back to our discussion.
Okay, now this is very interesting. So now you see chemicals can change not only our microbiome, they change our microbiome. So this is a chemical now the real name is Forever Chemicals. What is the meaning of Forever Chemicals? You will see that, I think either in this or another article, that when you get exposed to these chemicals, PFOA or PFOS, these chemicals stay in our body for at least 50 years. Now, if you are using non-stick pans or whatever in the kitchen, so the result of that will be these chemicals, they're getting into the body, form neo-antigen, and they stay there almost forever.
They're in flame retardant chemicals that has just been sprayed all over the entire city.
Yeah. So there are, but this is not only, there are 10,000, according to one of 10,000 of these type of chemicals only. They're in use in the industry. So it's not just really fire retardant. The fire retardant, when really I was looking at what was happening during the fires, but in this situation, what can we do? Do we have a choice?
No.
But remember, those chemicals coming back into the water, and we will drink them, and they will stay in our tissue forever. So what this title is telling you, after talking about neo-antigens. So chemicals getting into the human body, bonding to our tissue, are responsible for development of autoimmune diseases. That's what they're telling us. So now let's look at next one. That I like this type of analysis. So autoimmune disease has 3 or 4 different stages. Asymptomatic. You get exposed to these toxic chemicals, a year, 2 years, you may react and make some antibodies, but nothing. You don't have any symptoms to go to a doctor. So we call that asymptomatic. But this is the level. Reappearance of neo-autoantigens. So here, the neo-antigens are formed, and now you have more, and then the body reacts to that slowly and slowly. Look at this. Okay, complex with neo-antigens. Then the antibody is going higher and higher and higher and higher. And either you have to remove the neo-antigens, otherwise this will continue and will end up with full-blown autoimmune disease. Now let's look at a very simple experiment. I like sometimes simple experiments. And this was done in my own laboratories about 2-3 months ago because I believe, and I developed this test for sirens. If you are doing food IgG or IgA or even IgE testing, and you use raw food antigens, you miss 50% of the cases. Because raw egg is completely from cooked egg. Back to protein chemistry. It's denaturation of the egg white and the egg yolk. It's different from raw egg yolk and egg white. So that was an idea I came with in 2008. And so if you measure interest in food immune reactivity, even allergies, that's why first you have to do if we eat food in the form of raw, we have to measure antibody against raw almonds. When they are roasted almonds, the protein is different from raw almond. You have to test also against roasted almond. So that's why I'm writing an article now for a journal called Foods, and the topic is reaction to raw versus cooked food. And so I did this experiment. So we measured IgG and IgA antibodies against raw chicken meat, the blue. Very small percentage, 4%, 3 to 4% reacted against raw chicken meat. It's not highly antigenic. When you cook it, the percentage goes slightly higher. But if you add spices for tandoori chicken and you make an antigen from them and you run the antibody, look at the difference. From 4% went up to 12%. And for IgA, even more significant. So this is neo-antigen formation by chemicals with proteins that we are going to eat. And so in this particular case, we could have more immune reaction to that antigen, which is combination of not only the proteins plus toxic chemicals. Please.
Is there something in the chemistry of the tandoori? If you took a seasoned chicken, roasted it in the oven, would that be a bit different than a tandoori?
I didn't do that, but I'm sure it will be different, yes. Probably will be similar analogy. Yes, please.
Is there a possibility that since we know the more you tend to eat a food, your rate of creating a reaction or an allergy or an antibody against it increases? Do we collectively agree with that generalized statement?
Yes.
Okay, good.
But through this view, through the following explanation, that if you have leaky gut and you eat the same food every day, for example, I know that my wife had everyday flaxseed. And then I measured her antibodies very recently. For sure, flaxseed was the highest level of antibody in her blood. Because on top of that, also she has leaky gut. If the biological door is perfect, you can eat as much as you want. You are not going to produce antibodies.
Got it.
That's why you have to pay attention to leaky gut. If you repair that, then you can eat as much as you want of the same food. So that's the explanation.
Thank you
leaky
for that.
gut.
Yes. Now, could it also be that because people really generally don't have the tendency of eating raw chicken, that the IgG and the IgA antibody compared to cooked versions of it with the varieties of it, spices and then some, turns out to be higher, not necessarily because they don't have any reactivity towards the raw chicken that otherwise would make them sick, simply because it's something that they generally don't eat, which is raw chicken.
Yes.
Okay.
Yes.
It does.
Yes.
Also, on the same note, if you eat a food a lot, like let's say you eat peanut butter every single day, you're way more likely to have antibodies to it, right?
You are more than likely this is another avenue, please.
Okay.
I'm glad most probably you are not going to digest some of it. And some of it may get into the blood and you make antibodies. That's another explanation. One is through leaky gut, one through eating a lot.
Digestibility, your ability to digest.
That's why taking digestive enzymes always is a good idea, no matter how old you are.
Got it. Yeah, fascinating. Thank you.
Okay. What this title is telling you. Lifetime pesticide use and unmonitored antibodies in the male farmers from the agriculture health study. First of all, anti-nuclear antibody is the best screening, although developed 60 years ago, best screening for autoimmune disease. In the general population, up to 20 years ago, 4% had anti-nuclear antibodies, low titer. Now that is up to 16%. So when you go to rheumatologist and your patient is having anti-nuclear antibodies but no symptoms, they'll say, don't worry about it, go home and come back next year. I'm very much against that. Because that's the biomarker of future autoimmunity. You have to find the trigger and probably will prevent autoimmune disease in the future. Don't send him home or don't send her home. So now we see the triggers for the farmers, absolutely, because they're using so much pesticide, herbicide, glyphosate, and all of them bind to some of their food, to some of their tissues, and therefore anti-nuclear antibody. Okay, so trichloroethylene exposure and anti-nuclear antibodies, again, they look at thousands in China. And in fact, they had some kind of badge. They could measure the level of trichloroethylene in the workers. And they found correlation between level of exposure versus of anti-nuclear antibodies. So if someone will ask you that what are the causes of anti-nuclear antibody development, what will be your answer? Why we react to our nuclear material, which is inside our cells? Could be mercury, could be glyphosate, could be any other toxic chemical.
Doc, let me just ask you one more quick question. On the same note, just as if you eat a food alive, you might be more likely to have antibodies. Why sometimes do you get a test back and it says you have antibodies to some food that you never eat, like clams? How can that be?
Two answers. Okay, please forgive me. One is the laboratory is doing very bad job. There are many of those, I know them, okay? Like a laboratory recently, in order to compete with other labs, added like 30, 40 items, such as aspartame and food coloring and all kind of things, which they are not they do not form neo-antigen with human tissue. Even they don't understand. Or years ago, when I developed food IgG testing in 1986-7, I added sugar in one of the wells of the ELISA plates to double check my own technicians. And that was on my control. And then laboratories copied my laboratory, and then they started reporting antibody against glucose. How can you make antibody against glucose? So that's one, okay? Yeah. Secondly, yes, that let's take shrimp, that I had experience with a rabbi who was positive for shrimp and this is serious, years ago, or against pork antigen. You know, pork crush reacts with so many human tissue. Right? I explained to him at that time that you have antibodies against something else that reacts with pork or with shrimp. So cross-reactivity is another reason. Organic solvents, the same thing. Organic solvents and MS susceptibility. So now we take it one step further, correlation with the disease, neurologic disease. Okay, so I'm going to present after this a case a real case explaining precision, the importance of precision environmental. But overall, we are going to look at antibodies or cell-mediated immunity. Humoral, cell-mediated immunity. So, the case of chemical reactivity and autoimmunity. 54-year-old woman, after finishing art school at age 23, started painting with her fingers using oil-based colors. You know how toxic they are. At age 38, while continuing painting because that was not the source of income, so she had to find a job. Where? In print shop. So now you have double whammy. So at age 47, she started having all these symptoms of chronic fatigue, fibromyalgia. Right now we have the issue with long COVID. Similar symptomatology of chronic fatigue, fibromyalgia, multiple chemical sensitivity. Testing. Low white blood cell counts, cholesterol slightly high, the rest really maybe slightly elevated. Look at ANA, borderline elevation, SED rate elevated, and rheumatoid factor, slightly elevated, ENA, see 20 versus 24. So this is one of those cases that I'm talking about, that the antibodies are not highly elevated to say you have an autoimmune disease, but they are there. So this is the time to tell the lady, get out of that job and stop painting with your fingers. But she didn't do it. Nobody told her to do that. So these symptoms became more pronounced when she was dealing with all type of chemicals, including detergents and dry cleaning material. So she became having multiple chemical sensitivity. So finally a doctor understood what was going on and sent her blood to Cyrex laboratory. So this is a test for leaky gut, the dye of course, Cyrex. She made antibodies against acrylonitrile, but mainly against lipopolysaccharides IgA. Remember, please, the antibody, the most significant antibody in the gut is IgA. It's called mucosal antibody. So definitely she has problem with the microbiome disturbance and also leaky gut. Okay. Then there are other toxins in the gut in addition to lipopolysaccharides. So one of them is called bacterial cytolethal histamic toxin, although this is used for IBS, like your guest, Dr. Pimentel. Okay, but that is also indication of leaky gut. And then cytoskeletal protein. Acrylonitrile is only 1 or 2. And here we are using actinine, taline, and many other high junction proteins. For that reason, pretty soon will be announced by Cyrex that we are combining the Array2, which is for leaky gut, plus 22, which is for SIBO IBS, plus blood-brain barriers together with very, very special price. That will be, because we believe that these three should be together. When you have leaky gut, you're going to have, so this is supporting of leaky gut, you are going to have also leaky blood-brain barrier. So there's no doubt this patient is having leaky gut. Chemical antibodies. This is where we test for antibody against neo-antigens. But the area that you see, you will not be surprised, because aflatoxin from molds or from food, completely negative, formaldehyde negative. But look at isocyanate antibody. It's in paint, isocyanate, paint, and many other products. Trimellitic phthalic anhydride. It is major component of this. That's indirectly, you can measure actually if you have nano and micro and nano particles in your blood or in your tissue. Benzene solvents, they're also everywhere, in painting and everything. And then bisphenol A, real major part of plastic. And then tetrachloroethylene is also used in
Dry
cleaning. Yes, thank you. Thank you. And finally, some mercury compounds, also they are part of the paints and everything. Yes, please.
So if we're seeing IgA, does that indicate, therefore, that the gut is somehow involved?
Remember, the IgA is produced in the gut first.
Okay.
Later on, when antigens get into the blood, also you can make also IgA antibodies in the blood as well.
Okay.
So, but in here, most probably the antibodies are IgG, I believe. Although combination are measured together. But overall indicates exposure to toxic chemicals and neo-antigen formation. And then relation to pathogens, infections. The only thing was positive, H. pylori, which most of us are carriers of H. pylori, and so some antibodies were detected, but not much. So her problem was mainly with toxic chemicals. That's the test results showing. The continuation of chemicals also probably she was exposed to toxic mold as well. So this is additional thing we found. Now, several years later, remember the test results were borderline elevation. Okay? 7 years later. So this is the basic we have. Look at, this is serious. This is found in patients with autoimmune disease. DNA the same thing, rheumatoid factor, immune complexes. Double-stranded DNA, no, because double-stranded DNA is found in lupus. So she didn't have lupus. Actin antibody, non-significant mitochondrial antibody. So most probably this patient developed mixed connective tissue disease due to exposure to toxic chemicals. Thyroid antibody elevated, TPO especially very, very high. So thyroid autoimmunity on top of everything. So remember please that there is no such thing as single autoimmune. Usually they are together, 2, 3, or 4. We call it multiple autoimmunity. So this patient developed multiple autoimmunity. Then the lymphocyte map. Total white blood cell was low because everything, by the way, is calculated based on total white blood cells. Percent lymphocyte is calculated based on total white blood cells. So she has only 900 soldiers to fight for her. To begin with, that's already a problem. Instead of having, the ideal would be like 1,800, 2,000. So T cell, and then B cell, and then look at total B cells. This is all because of low. Yeah? When you have low number of soldiers, everything will shift to the left. Low numbers. Percentages are okay, but the numbers are low. And then CD4, CD8, and then CD4, that's again, and CD4, CD8 ratio. To look at CD4 and CD8, the best is to look at the ratio. And look at that ratio, instead of the ideal is 2.0 or 2.5 maximum. This type of CD4, CD8 ratio is found in patients with full-blown autoimmune disease. And we already know this patient has mixed connective tissue disease and thyroid autoimmunity. So the LMAP is giving you a lot of information. So that's one ratio. Next. Okay, helper cell, because when helper cells are high, CD4 is high, CD8 is low. CD4 either is Th1, Th2, Th17, or Treg. So here we see some of those are Th1. Some of them are, that's why the ratio. But also there are low Th17 because of the low numbers to begin with. And then some natural killer cells are elevated because they're fighting something in the body. So with that, you see that the test results, looking at humoral and cell-mediated immunity, you can analyze and find out that what patient is suffering from. So remember, the detect, remove, and repair. If you do that, hopefully you'll be able to prevent further worsening of autoimmune condition in this patient. Of course, if the patient will listen to you guys to be removed from that environment. Otherwise, if the patient has no choice and continue being on the same job and do the same thing, then you're not going to be successful. So finally, I would like to leave some time for questions. And so here, this is really what I found in this journal, that you see they're talking about diagnosis, treatment, prevention, but there are many exposure, diagnosis, prevention, treatment, but still there are many parts of the puzzle of precision environmental health are there that we should learn more, study more, and learn more about it. But none of them out there have experience like those who are practicing functional medicine, personalized and lifestyle medicine. So with that, thank you so much, and I'm ready to answer some questions. I believe we have about 15 minutes until they will close the library, right?
That's true. Yes.
Okay, please.
Have you found that separating the foods and combining, like let's say carbs versus separately versus proteins, that the immune reactivity to decrease over time better than combining, like let's say proteins and carbs together? Because anything that out there that could be that, because I've been researching quite a bit on separate, like literally having the patients in, let's say, sweet potatoes and salad, and then have chicken with salad versus having sweet potatoes and chicken. And then purely clinically, I've been finding quite great results and much less reactivity to a lot of things, and also combining a lot of foods with leaky gut. I haven't really found much literature on that to support that, and I was wondering if you have anything to say to that,
Thank you
or
for
if
asking.
there is anything.
Thank you for asking that. First of all, the field of nutritional immunology is growing very, very fast. What they are doing actually is, let's take example of resveratrol. They gave resveratrol of different dosage to mice and human. And they found that by giving resveratrol, they can bring down the level of autoreactive lymphocyte, Th1 and Th17, and increase regulatory T cells, because helping to regulate the immune system. There are lots of studies on polyphenols, name it. There are a lot. But none of those are the kind of experiments that you and I like, to combine different foods and see whether or not people react differently to each one of these. Unfortunately, no, I haven't seen anything in all these journals who publish about nutritional immunology.
Yeah, because as far as I know, combining this like you develop a completely different protein, like you can combining two different foods, and the more mixture you have, like that. I mean, this came from my personal experience because I've been sensitive to a lot of foods. So by separating the foods, I found much better. Like I can tolerate a lot of things versus. So I started to apply that with the patients. So I don't know if anybody was trying that, but the results are absolutely incredible. I mean, incredible. Even with the old supplementation that I used before, but now I literally make them separate and at least 4 hours in between the meals of the same one, and the results are great. And I wish I could find some studies and not the only one doing it.
Yeah, we can learn that a little bit from the kosher law. Like you cannot mix dairy product with meat.
Right.
If you eat dairy, you have to wait 4 hours and then you can have meat. But unfortunately, we don't have any research even to back up that, which is much simpler than what you are asking. Unfortunately, we don't have that. So somebody like you should get together with Silex and say, let's do this research together and publish it.
Yeah.
That's the only way we can do it. I'd love to do research, and but no one has done that. Next. Then.
Do we have good data before and after on blood-brain barrier, gut-brain barrier, seeing that there's significant improvement with various protocols?
The same study with resveratrol, I think, and other studies, they showed if there is a single item for repairing the blood-brain barrier, is resveratrol. Published about it. And then also I published about if patients having leaky gut, like lipopolysaccharide and zonulin, antibodies are elevated. What are the chances to have S100B or blood-brain barrier protein antibody also to be elevated? I published that. 70%. 70%. Your patient is having leaky gut, 70% probability of the same patient having leaky brain.
And do we have studies correlating leaky brain with neurodegenerative diseases?
Absolutely. Yes, many. Yes.
Could we further assume that would there be leaky brain, blood-brain barrier, and not leaky gut in some cases?
There is, I cannot say no, but there is possibility, maybe 10% of the chance that the gut is perfect, but something else from the blood, like toxic chemicals or something, are causing leaky blood-brain barriers. We had another one and then over there. Yes, please. Please.
This is all through blood, correct? Your tests are all through blood?
She's asking, are all your tests through blood?
Yes, all of our tests are through blood, except one, we are using saliva.
And do you, for younger patients, how many tubes of blood for each?
Even if you want to do all tests of Cyrex, you can have one tube of blood doing everything, believe me. Remember, we are using 100 microliter of serum. We dilute that 1 to 100, and then we use that. So one tube of blood will be sufficient for all the tests done at Cyrex. Please.
I had a question with a patient who already has an active autoimmunity or like on certain medications, and so like Lyrica or some other thing, so which is definitely going to give us a completely wrong result. Whether there's a realistic time that they can have them all for a certain period of time to get actual true results without having the immune suppression. Does it affect?
What the medications causes immune suppression?
Doesn't it? As far as
yeah.
like
if
they're actively on a Lyrica, for example.
Yes.
If I want to test them specifically, because we're not going to have true results then. So what do we do with that? So for those type of patients, I mean, if they're still symptomatic, but not,
Remember, the medication for autoimmunity is not really going to shut down completely. You're not going to make zero antibodies. I think it's going to reduce the antibodies like 40%.
But it's
I will still will do the test, but in patients with autoimmunities on medication, for example, if 1 to 40 for ANA is positive, I will consider that, like 1 to 80 for that patient. Or because not always you have a choice to stop, telling the patient stop taking medication. That's huge responsibility.
We're soon going to have millions of Americans taking GLP-1 agonist drugs that slow down gut motility. Does that modify the likelihood of sensitivities developing?
Yes, I have no doubt. Yes.
So we're likely to see an increase in autoimmunity as well.
Yes. Unfortunately, thousands and thousands every day taking more, and the numbers are increasing.
Anything is just a medication or a peptide would be missing in the GLP-1 agonist. Does that only apply to the medications?
In fact, honestly, I wanted to measure antibodies against GLP-1. Remember, the antigens in our body first becoming peptides. It is the peptide that getting presented by antigen-presenting cells to T cell and then B cells and produce antibodies. So because you are using peptide, it doesn't mean you are not going to make antibody against it. Okay, so it will be nice to take like 50 patients who are on GLP-1 and test them for antibody. See how many of them make antibodies. Because those who make antibodies, I think they are going to be in trouble in the future.
So they're going to have antibodies against the GLP-1 peptide.
Yes, and
and will there also be increased antibodies to the foods since the food is sitting in their stomach longer?
Study about cross-reactivity. We don't know GLP-1 cross-react with how many tissues. Then those antibodies will attack the tissue. So if you have patients, let me know. If we can collect blood, just be in touch with me.
There are many, many patients on these drugs.
So what is the mechanism that allows nanoplastics or microplastics to cross the blood-brain barrier? Is it just size? Or is there another mechanism that allows it to cross the barrier?
Excellent question. One, yes, is the size, but the nano versus micro is huge difference, right? It's 1,000, right? Nano, micro, yes, 1,000. So how come I understand that the nano can get into the brain, but how come the micro can get into the blood, in the brain? I think leaky brain. In the brain, leaky brain. But in one of the articles showed that the nano and micro, they get from the trigeminal nerve and all of that from the nose into the brain. They talk about that route of entry, which I was very surprised about that.
And we also know the blood-brain barrier is more permeable than we thought it was to begin with.
Yes.
Now that we've learned that there's bacteria and pathogens in the brain, and that's actually how the amyloid gets formed to protect because they're antimicrobial.
Yes. Let me give you another example. You know that alpha-synuclein is part of the Parkinson's. But did you know that in the gut, the bacteria and all, they produce a lot of alpha-synuclein. And this alpha-synuclein, huge size, can get into the brain and then causing some of the symptomatology of patients with Parkinson's. So yes, everything is about leaky gut or leaky brain.
Is that related
And
to
in this case, it's leaky nose.
Is that related to the constipation that patients with Parkinson's get decades
Possibly,
before
yes.
they get Parkinson's?
Possibly, yes.
I was just curious, thinking the choroid plexus in the brain gets perfused with blood. Could that produce something that could be antigenic in the brain?
Oh yes, we make anti-synuclein
question?
antibodies. Anti-synuclein antibodies, part of the diagnosis of Parkinson's among functional medicine doctors. You had that.
Apart from resveratrol, is there any other compound that you found, whether it was your own experience or there's been adequate research done on, that protects the blood-brain barrier?
Yes. So, shall we give them some kind of news that Ben and I, we are planning to have some kind of once a month podcast that will take articles like that and share with you guys. So we think it's a good idea.
Excellent idea.
Okay. So maybe we should start with nutritional immunology. First with immunology and then nutritional immunology. Okay, so I think that's it, right?
Yeah, okay, thank you everybody.
Thank you so much.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.